Hi, we're Streamline. I'm Nurhan Mustafa. I'm Fatwan Mu'min.
My name is Anna DeYoung.
I'm Junior Kim.
And I'm Annalisa Anderson.
By designing a home organizational system that reduces spatial clutter, cognitive and emotional strain decreases, easing insecurity and promoting social engagement, which ultimately reduces isolation. For our methodology, we first developed a persona, fleshing out the story of Sean and focusing on his needs and tendencies. We then researched the equipment he uses and how they should properly be stored. We also interviewed a parent with diabetes to understand their experience and used the VR to build empathy in our framework. We also would like to call out the lecture by Martina Filoni for its discussion on clinic pathways and reducing stress on patients. From this lecture, we developed a focus on accessibility within the home for a patient that does almost daily home treatments.
Our persona is Sean Gomez. Sean is a 30-year-old father who works the third shift at a factory. He has type 2 diabetes as well as kidney disease, and he's been struggling with all the upkeep of his conditions on top of his work schedule and caring for his daughter.
Sean views home as a place to strengthen and secure relationships with others. As an extroverted persona, he values social engagement as a form of recharge. While navigating dialysis at home, Sean finds himself feeling more self-conscious with the clutter his medical equipment is causing. How might lack of organization encourage isolation? Well, the lack of organization in his home has sparked feelings of shame and embarrassment. Guilt begins to ask questions like, why am I unable to maintain my home? And how have I fallen so far behind? Gradually, Sean develops avoidant behaviors such as pulling away from others or pushing others away from him due to the pressure of saving face. The distance he creates becomes mental and emotional, not just physical.
Space has a powerful influence on a person's treatment and overall well-being, shaping both how we feel and how we function. Because of this, primary healthcare spaces should be psychological supportive, fitting between a person's functional abilities and the demands of their treatment, allowing care to be carried out safely and comfortably. Home modifications can support this by facilitating self-care and strengthening primary home care through products, technologies, and design adaptations. Without proper structural support, care tasks can become riskier and more burdensome, especially when hazardous layouts get in the way.
We're showing how Sean's routine is shaped by night shift work and the demands of diabetes and kidney disease. He sleeps during the day and spends an early evening on home hemodialysis, leaving very little time for meal, checks, or preparation. By the time dialysis and post-care are done, he's already exhausted, but he still has to head straight to work. His living space also has to support eating, relaxing, and medical treatment all in one same area, which creates major challenges, showing the needs for a better, more supportive design.
Once we have analyzed the conditions that contribute to Sean's lifestyle, we asked a series of questions as well as jumped into the VR to better understand what kind of design intervention Sean needs.
For the design, we focus on home organization through either purchasing furniture or building them. The outcome is to reduce emotional and cognitive strain. The theoretical framework is to address his poor mental health through providing Sean with the space and time with his daughter and community. This is achieved through encouraging better organizational systems.
With option one, Sean can purchase the furniture he needs to create a more organized and functional space. The adaptable wooden chairs can serve as seating for three guests, and with added cushions, they become more comfortable. They can also be rearranged into a shelf when not needed, offering flexible configurations as long as they form some kind of a square. In addition, the nightstand provides space for Sean's CPAP machine and supplies, allowing him to keep them visible and accessible at night or stored discreetly below them when guests visit. Lastly, the coffee table includes storage spaces underneath that fit the same boxes that already exist in the living room, keeping his items hidden unless he chooses to share their contents. For option two, Sean has the opportunity to build custom furniture for his home instead of purchasing it, which would give him a sense of agency and allow him to shape his space accordingly, taking an active role in alignment with his needs and preferences.
With this quick and affordable design intervention, we mapped how this would improve Sean's development throughout the course of a year, leading to the implementation of healthy habits and choice making solely through design.
For the near, we look 10 to 12 years in the future at how organizational systems can be adaptive and multifunctional. For example, we could design a storage system that organizes medical supplies and has a built-in digital layer to record data in sync with the patient's app. In 25 years, we aim to create an integrated organizational healthcare system that is built into the foundation of the home. As the core of the living space, healthcare no longer becomes just an afterthought, but a driving factor that is seamlessly embedded into the structure of the house.
This map shows the evolution of the design between now and a 25-year period, where the intervention starts as a strategic placement of simple mass-produced furniture pieces and evolves into a system that is incorporated within the home, making healthcare at the core.
As we consider the now, near, and future, we recognize organization as self-help.